everyone. My name is Victor Krausak, and welcome to my presentation on hormone replacement therapy. I'll just give you a brief introduction regarding my own personal experience with hormone replacement therapy. About 5 months ago, I was feeling lazy, lethargic, tired. I wasn't sleeping right, and I just felt something was off. So I went to the doctor, and the doctor recommended that I try testosterone replacement therapy. Since then, I've been sleeping much better. My memory has improved, and my deadlift has increased from 300 pounds to 585 pounds, and my bench press has gotten up 200 pounds as well. I feel better, and arguably, I look better. But what is TRT and hormone replacement therapy? Well, hormone replacement therapy is a medical treatment used to supplement the body with hormones that are no longer being produced or being produced in insufficient amounts. As we age, our bodies slowly decline and hinder the production of such hormones, resulting in decreased libido, bone density, and muscle mass, as well as increased body fat and cardiovascular risk factors. Let's talk about the physiology of the natural hormone production in our bodies. First, hormones are produced in the sex glands. In females, it's the ovaries, and in the males, it's the gonads or testes. Then, the adrenal glands secrete a precursor hormone called DHEA. Then, the body converts the DHEA into either testosterone or estrogen. This process involves the hypothalamus releasing gonadotropin-releasing hormones. And lastly, the pituitary gland releases a luteinizing hormone, or LH, controlling testosterone production. Now let's talk about the various types of hormone replacement therapy and how they are administered. In men, the most common is testosterone replacement therapy in the form of injections, but there are also creams, tablets, and something called subdermal inserts, where they make an incision in your rear end and insert dermal implants. For females, it's quite similar. Estrogen progesterone therapy. There's oral medications known as Premarin or Estratab, skin patches like Estroderm. There's also topical creams and gels. So now that you know what HRT entails, let's just go over the practical applications. For men, it increases muscle mass, and that's exacerbated with proper diet and exercise. It helps with fat loss, it improves cardiovascular health, and enhances your libido. And for women, it also prevents bone loss and osteoporosis and improves mental cognition. According to the Wiley Online Library that I accessed on June 29th, 2024, men on testosterone replacement therapy experienced increased sexual, cognitive, and muscle function and improved overall body composition. There are psychological applications as well, including improved mood. This is because it helps balance neurotransmitter activity in the brain, increasing serotonin and dopamine. It combats anxiety and depression and improves sleep. There are also psychological applications for women as well. It improves their mood, alleviates mood swings, anxiety, and irritability, and helps alleviate symptoms associated with menopause. There are also preventative benefits, including reducing the risk of heart disease and cardiovascular disease as well, including stroke in men and women. Now that you see the many uses of hormone replacement therapy, let's take a look at some supporting evidence. There's a case study in 2018, 40% of US men are obese in this country. 24.2% of men over 18 met the 2018 physical activity guidelines, which means 3/4 are overweight or in poor shape. And according to the National Library of Biotechnology Information website, which I accessed on June 29th, a meta-analysis showed that out of 762 men, 92.4 showed signs of depression, but after being on testosterone for 1 year, that number significantly dropped to 17.3%. So now that we have talked a little bit about side effects, now that we have talked a little bit about its applications, let's talk about side effects. In men, testosterone therapy can cause an enlarged prostate, acne, oily skin, and since TRT increases your red blood cell count, there's a slight risk of blood clots. So that's why doctors do monthly monitoring as far as blood work. So in conclusion, I have briefly described hormone replacement therapy, including testosterone replacement therapy, its physiological applications, some statistics and case studies, and finally, the potential side effects. So the next time you catch a glimpse of yourself in the mirror, you might want to ponder the merits of hormone replacement therapy as a potential avenue for enhancing your physiological well-being, it's an option worth reflecting on, quite literally. However, it is